Hi, everyone. I am Camellia, a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I am actually just sharing today something a little more specific, and that is related to your salary as a PMHNP. Okay. A few things have motivated me to do this, including those of you that have asked specific questions around salary. Should I be accepting this salary? What's normal? So I just wanted to kind of focus in on that here. I did a couple of videos a while back when I first started the channel, talking about the 5 facts of a PMHNP, and then I also did one about questions to ask before accepting a PMHNP role. So some of these things sort of intertwine, but I do want to just talk more specifically about the salary piece of it. Because again, it's so variable, and I really want to focus on what goes into that decision and also what you can have as leverage for negotiation. Okay. So the first thing to consider if you are a PMHNP, is the fact that you are considered a specialty. Okay. So that's one of the reasons that you will see if you do any data, pull any data related to salary, regarding the PMHNP role, you are going to see that as a nurse practitioner or an APRN, PMHNPs are paid higher, and that's mainly because it's deemed as a specialty. Okay, so that's one of the perks of having the certification. Okay, that's sort of the top of the pyramid here, and then now I just want to focus on what falls below that. So your basis is going to be, because you're a specialty compared to other nurse practitioner roles, you are likely going to be on the higher end of the scale. Okay. The other things to consider, though, would be one is whether the setting that you're working in. So your setting, whether that's inpatient or the emergency room or inside of a hospital facility, whether that's outpatient, and whether you are going to be working private practice. Okay. I will tell you that it varies. In most instances, those that work in hospital facilities and acute care are paid higher than those that work in outpatient. Okay. Outpatient is just a general term, but if you're working for a larger organization as an outpatient PMHNP, just know that your salary may scale a little lower than someone or a position for an acute care facility, such as working inpatient behavioral health or the emergency room. Okay. Also, that plays into, in most cases, the acuity of your patients it's higher. And we won't get into scheduling and all the other things that are a little different there, but that's the main difference, with salary. Private practice, though, is sort of its own entity. It can fall into the outpatient arena, but the difference with private practice is that in most cases you are going to be having some negotiation with a contract. Some private practices, you're salaried, but most you are working based on a contract or contractual agreement as a contractor. And so sometimes that looks like your pay is higher. You're paid per patient, or you're paid per visit in a contractual agreement. Again, you may find that the salary is more negotiable and or a little higher in private practice as well. Okay, and that's because there is a lot more flexibility with what can be charged for patient services in a private practice setting. Okay. So we've talked about the fact that you're a specialty. We've talked about the setting, which plays a huge part. Now I want to talk about experience. Okay. Experience is important. And it plays a part in possibly where you fall on the spectrum. For most larger organizations, you are paid an X amount for the first few years. And then once you gain more experience, you are paid a different amount, and it's based on sort of a tier level. Okay. That doesn't mean that you can't start out on a higher tier if you already have that experience. So this is based in clinical experience as a PMHNP. Okay. It is not based in your RN experience. So this is a question that I get a lot. Your RN experience is most valuable for you as an individual and professional in learning and knowing how to work with patients and a lot of the communication, building rapport, all the techniques that are so important in nursing and also in behavioral health as a nurse, if you work at the bedside. However, when we factor into your actual experience, some jobs will be looking that you've had some mental health experience as a PMHNP, but more specifically looking for that experience as a PMHNP and not as a bedside nurse. Okay, so that is important to remember. I get that question quite often. Your nursing experience will not weigh as much as a whole as your experience as a provider, okay, as a psychiatric provider. And that does put you in a different category. The last thing that I want to talk about related to your salary has to do with incentives, okay? Most larger organizations and some of the private practice facilities do offer incentives. So there's incentivized compensation. And what that means is that you can be paid more or you can be paid a bonus annually based on how you perform with those incentives. So I'll give you a few examples. One is your quality of care, and there's different ways that organizations look at that, whether it's patient satisfaction scores, whether it's bringing down scores based on metrics for patients that you have them to complete based on screenings. There's a lot that goes into that, okay? Patient satisfaction is also a huge factor. There are times where you have to have some set amount of therapy for some facilities. You have to have screenings done, such as a PHQ-9, a GAD-7. You have to complete those things, and that all factors into your incentives. And really what's based in the incentives is the quality that you can provide, that you're showing or demonstrating that you can provide for patients. Okay, so those are just a few things I wanted to touch on here. Of course, I can go a really long time by elaborating more, but I want to use this as sort of a very short, brief way to think about where you fall on the compensation scale and why you should fall either higher or possibly a little lower to start as a PMHNP. Okay, so just to recap here, first is that you are probably on the higher scale because you are a specialty. Secondly, you want to consider your setting, whether inpatient, outpatient, in any type of larger organization or facility and or private practice. Thirdly, you want to consider your PMHNP experience. Remember, not specifically nursing experience. And then fourthly, you want to consider the incentives that play a part. And usually the incentives are sort of an additional part of your compensation from your base pay. Okay. So these are also things, guys, I want you to think about when you are leveraging or trying to negotiate for your salary. Okay. I recommend everyone to at least do a general search for the average salary of a PMHNP first universally in the United States, and then see where you fall in terms of your state. Okay, it varies a lot based on your state. So do find that information out so that you know whether you fall higher or lower, and then again considering those factors that I just talked about as to whether you can negotiate for a higher pay because you have more experience. And you'll just have some questions around those things. Okay. I'm hopeful that this is helpful to someone. But again, this is very generic, very structured in terms of specific things to be looking for related to your salary. If you guys have additional questions, keep in mind that it is based on a state by state, just state by state, it's different. But I will say that for the most part, these general things are pretty universal. Okay. So if you have other questions, let me know. That I look forward to hearing you guys and seeing you guys in the next video.